This is Pathology Chapter 5, Part 3. Abnormalities in the size of teeth include Microdontia or Macrodontia. Microdontia is where one or more of the teeth are smaller than normal. Microdontia involving a single tooth is far more common. The maxillary lateral incisors and maxillary third molars are the most commonly involved teeth. The true generalized microdontia is seen in a pituitary dwarf where all teeth are smaller than normal. Generalized relative microdontia are normal-sized teeth that appear small in a large jaw. Macrodontia is where one or more teeth are larger than normal. A true generalized macrodontia is seen in cases of pituitary gigantism. Relative generalized macrodontia is large teeth in a small jaw. Macrodontia affecting a single tooth may be seen in cases of facial hemihypertrophy. Abnormalities in the shape of teeth include gemination, fusion, concrescence, dilaceration, enamel pearl, Talon Cusp, Taurodontism, dens in Dente, dens Evaginatus, and Supernumerary Roots. Gemination is when a single tooth germ attempts to divide in two. It appears as two crowns joined together by a notched incisal area. Radiographically, usually one single root and one common pulp canal exists, and the patient has a full complement of teeth. Here are some images of gemination. Fusion is the union of two normally separate adjacent tooth germs. It appears as a single large crown that occurs in place of two normal teeth. Radiographically, either separate or fused roots and root canals are seen. The patient is usually short one tooth. Here is an image of fusion where the central and lateral incisors are fused. Concrescences are where two adjacent teeth are united by cementum. These are usually discovered on radiograph. Dilaceration is an abnormal curve or bend in the root of a tooth. Dilaceration is usually discovered on radiograph and may cause a problem if the tooth must be removed or a root canal needs to be performed. Here is an example, and here is another example as well as here. An enamel pearl is a small spherical enamel projection on a root surface. It is usually found on maxillary molars. Radiographically, it appears as a small spherical radiopacity. Removal may be necessary if periodontal problems occur in the furcation. A Talon cusp is an accessory cusp located in the cingulum area of a maxillary or mandibular permanent incisor. It contains a pulp horn and may interfere with occlusion. Here is an example of a Talon cusp on the lingual of tooth number 7. Taurodontism is where the teeth have elongated pulp chambers and short roots. It may occur in both deciduous and the permanent dentition. It is usually identified on radiographs. Here is one example, and here is another. Dens in Dente occurs when the enamel organ invaginates into the crown of a tooth before mineralization. Radiographically, it appears as a tooth-like structure within a tooth. It is vulnerable to caries, pulpal infection, and necrosis, and is frequently accompanied by a periapical radiolucency. Here is the invagination. Dense Evaginatus is an accessory enamel cusp found on the occlusal tooth surface. It is most often seen on mandibular premolars and may cause occlusal problems. You can see right there in the center. Supernumerary roots may involve any tooth. Most commonly, it is seen in maxillary and mandibular third molars if multi-rooted teeth are involved. It may become clinically significant if removal or endodontics is necessary. Here is an example of a supernumerary root on a premolar. Abnormalities of tooth structure include enamel hypoplasia, enamel hypocalcification, endogenous staining of teeth, and regional odontodysplasia. Enamel hypoplasia is the incomplete or defective formation of enamel and may be due to many factors such as amelogenesis imperfecta, febrile illnesses, vitamin deficiency, infection of a deciduous tooth, ingestion of excessive amounts of fluoride, congenital syphilis, birth injury or premature birth, and idiopathic factors. Enamel hypoplasia caused by febrile illness or vitamin D deficiency. The ameloblasts are one of the most sensitive cell groups in the body, and any serious systemic disease or severe nutritional deficiency can produce enamel hypoplasia. Enamel hypoplasia of an adult tooth may result from infection of a deciduous tooth. A single tooth is usually affected, and it is referred to as a Turner tooth. The color of the enamel may range from yellow to brown, or severe pitting and deformity may be involved. Enamel hypoplasia resulting from fluoride ingestion affected teeth exhibit a mottled discoloration of enamel. Ingestion of water with 2 to 3 times the recommended amount leads to white flecks and chalky opaque areas of enamel. 4 times the recommended amount of fluoride causes brown or black staining. Here is an example of enamel hypoplasia resulting from excessive fluoride ingestion. Enamel hypoplasia can also be the result of congenital syphilis, which is transmitted from an infected mother to her fetus via the placenta. Mulberry molars have a berry-like appearance, as you can see here, and Hutchinson's incisors are shaped like screwdrivers. Enamel hypoplasia may occur due to trauma or injury at the time of birth. Even a mild illness or systemic problem can result in enamel hypoplasia. Enamel hypocalcification is a developmental anomaly resulting in a disturbance in the maturation of the enamel matrix. It usually appears as a chalky white spot on the middle third of smooth crowns. The underlying enamel may be soft and susceptible to caries. Endogenous staining of teeth is the result of deposition of substances circulating systemically during tooth development. It may be due to tetracycline antibiotic, erythroblastosis fetalis, which is an Rh incompatibility between the mother and the baby, neonatal liver disease, or congenital porphyria, which is an inherited metabolic disease. Regional odontodysplasia are also known as ghost teeth, and they exhibit a marked reduction in radiodensity and a characteristic ghost-like appearance. It has very thin enamel and dentin and is usually treated by extraction. Impacted teeth cannot erupt because of an obstruction. Embedded teeth do not erupt because of lack of eruptive force. And another category of abnormalities of tooth eruption include ankylosed teeth. This is an example of an impacted tooth that cannot erupt because it is stuck against the tooth in front of it. Impacted and embedded teeth. Any tooth can be impacted. Third molar impactions are classified according to the position of the tooth. Teeth can be completely impacted in bone, or they may be partially impacted. Partially impacted teeth are prone to infection. Impacted teeth may be surgically removed to prevent odontogenic cyst and tumor formation or damage to adjacent teeth. The optimal time is between 12 and 24 years of age. Ankylosed teeth is where the cementum is fused to the bone. It prevents exfoliation of the deciduous tooth and eruption of the underlying adult tooth. An ankylosed deciduous tooth appears submerged and has a different sound when percussed. It has a kind of dull thud, and you can see how it appears submerged. In ankylosed teeth, the periodontal ligament space is lacking. They are difficult to extract. Removal of deciduous teeth is necessary for eruption of the adult successor, and removal of adult ankylosed teeth may be necessary to prevent malocclusion, caries, and periodontal disease. The following are discussion questions with your instructor. This concludes Pathology, Chapter 5, Part 3.